Tell me the truth, this is the end. I feel like lose myself. Bring me to the top, can find you in the end. You'll never cry for me. Ooh, so tell you all the truth. 나의 두 눈을 감으면 떠오르는 그 눈동자 자꾸 가슴이 시려서 잊혀지길 바랬어. 꿈이라면 이제 깨어났으면 제발 정말 네가 나의 운명인 걸까. Love only you. Little sweet 16, suddenly I'm watching American Pie with you on a Saturday night. Your friend.
Hi, my name is Ahmad Rais Aiman bin Ahmad Fuad. My matrix number is 24003080 and I am from group 4A. Today, I will give an introduction about pleural disorder. Have you ever felt a sharp stabbing pain when you take a deep breath? That discomfort might trace back to a vital but often overlooked part of your respiratory system, the pleura. The pleura is a delicate two-layered membrane, like a balloon wrapped around your lungs, with a small amount of fluid in between. Its job is simple: to allow your lungs to glide effortlessly within your chest cavity every time you inhale and exhale. But when this crucial system is disrupted, it leads to what we call a pleural disorder. Whether it's inflammation, known as pleurisy, or an abnormal collection of fluid called a pleural effusion, this condition can seriously impact your ability to breathe. In this video, we'll deep dive into the most common pleural disorder, explore their causes, and discuss. Understanding the pleura is the first step toward protecting your respiratory health. Let's get started.
Hello everyone, my name is Naradila Natasha Venture Slide and my matric number 24003035. So now I will explain about type of pleural disorder. There are 6 types of pleural disorder, which is pleurisy, pleural effusion, pneumothorax, hemothorax, epinema, and sclerothorax. So, the first of all, pleurisy. Pleurisy is inflammation of the pleura causes sharp chest pain, especially with breathing. It may result from infection or autoimmune disease. Second, pleural effusion. Pleural effusion in excess fluid collect in the pleural space, usually to the heart failure, infection, or cancer. Patients often experience shortness of breath and chest discomfort. Third, pneumothorax. Pneumothorax is enter the pleural space and causes the lung to collapse. It can happen spontaneously from the lung disease or due to trauma. Symptoms include sudden chest pain and difficulty breathing. Fifth, hemothorax. Hemothorax is blood accumulates in the pleural space, commonly from chest injury or surgery. It increases pressure in the chest and affects breathing. Fifth, epinema. Epinema is pus burst up in the pleural cavity, usually as a complication of pneumonia or infection. Patient may have fever, cough, and shortness of breath. And the last one, sclerothorax. Sclerothorax is milky lymphatic fluid collect in the pleura due to injury or blockage of the thoracic duct. Large amount can impair breathing. That's all from me.
Hi, my name is Nur Kiasatina Najwa binti Syajah. My matrix number is 24003034. Today, I will talk about the clinical manifestation of pleural disorder, which can be divided by general and specific clinical manifestation. The most common clinical manifestation that patient may develop when having a pleural disorder disease is a pleuritic chest pain, which is a sharp and stabbing pain with a deep inspiration or when coughing. And then patient also may develop dyspnea, which is shortness of breath due to decrease of lung expansion. And then patient also will have a cough which is usually dry and non-productive cough. Patient also will have a tachypnea, decreased breath sound and chest expansion, and also a friction rub, which is a coarse and grating sound heard on auscultation. Alright, this is the example of a coarse and grating sound that was heard on auscultation, which is explained as a friction rub, one of the common clinical manifestation of pleural disorder. Another clinical manifestation for a patient with pleural disorder disease is a pleurisy or pleuritis, which is a sharp localized chest pain that also worsens with a breathing and when coughing. Number 2, patient will have a pneumothorax, which is a collapse of lung, which occurs when air leaks into a space between patient lung and chest. The last one is hemothorax, which is collection of blood in a pleural space. Nurses or doctor will detect a dryness on percussion for a patient that have a hemothorax. Thank you for your attention. Bye.
Hi, let's go on to the next part, where I will explain the etiology of the pleural disorder. Pleural disorder can arise from many different factors, ranging from infection to chronic medical conditions. So the first one is infection. Infection is viral infections commonly cause pleurisy, while bacterial infections such as pneumonia can lead to emphysema. Tuberculosis can also involve the pleural. Second, congenital heart failure. Congenital heart failure is one of the most common causes of transudative pleural effusion due to fluid overload in the body. Third is cancer. Cancer like lung cancer, lymphoma, or cancer that spread from other organs can affect the pleural. When this happens, it can cause fluid to build up, malignant pleural effusion, or the formation of tumors on the pleural. Fourth, pulmonary embolism. Pulmonary embolism is blood clot in the pulmonary arteries, can cause pleural inflammation and lead to pleural effusion. Fifth, trauma. Trauma is chest injury such as plain frost or penetrating trauma may cause pneumothorax or hemothorax. Sixth, autoimmune disease. Autoimmune disease is condition like lupus or rheumatoid arthritis can trigger inflammation of the pleural. 7. Kidney and liver disease. Kidney and liver disease is fluid imbalance due to this condition can contribute to transudative pleural effusion. And the last one, asbestos exposure. Asbestos exposure is long-term exposure to asbestos fiber can lead to pleural thickening and malignant pleural mesothelioma. That's all from me.
Assalamualaikum dan salam sejahtera. I'm Ruik Matasha, number matric 3003. Today I will briefly explain the investigation for pleural disorder by the type. First, for pleural effusion, there are 4 main investigations. The chest X-ray is usually the first step. It helps identify the presence of fluid by showing blunting of the costophrenic angle or visible fluid levels. Next, a CT thorax provide a more detailed view, especially for detecting small effusion, loculation, or any underlying pathology. Third is thoracentesis, which is important for both diagnostic and therapeutic purpose. The fluid obtained will then undergo pleural fluid analysis, which is include FIMI, CNS, AFB for TB, gram stain, and cytology to look for malignancy. Second, for emphysema, the diagnostic approach start with clinical examination. On auscultation, breath sounds may be reduced or absent over the affected area. Chest percussion often reveals dullness due to pus collection. A CT thorax is valuable to identify the extent of regulated pus and guide further management. Lastly, for pleurisy, investigation focus on identifying the underlying cause. A chest X-ray is done to rule out pneumonia, effusion, or pneumothorax. We may also perform sputum analysis, including FIMI, CNS, and AFB if TB is suspected. If there is suspicion of pleural fluid, thoracentesis may be also performed. In summary, this investigation helps differentiate between the condition and guide appropriate management. So that's all from me. Thank you.
Hi everyone. Today I'm going to talk about the common complications that can occur in pleural disorders, and I will keep the explanation simple and easy to follow. One of the main complications is empyema. This happens when the pleural fluids become infected and turn into pus. Patient may develop fever, chest discomfort, and difficulty breathing. Empyema usually needs antibiotic and drainage because the infected fluids cannot clear on its own. Next is parapneumonic effusion, which is commonly seen in pneumonia. If this fluid becomes more severe or complicated, it can progress into empyema. That's why early treatment of pneumonia is important to stop the infection from worsening. Another complication is pleural thickening. This occurs when the pleural becomes stiff due to lung inflammation or repeated infusion. When the pleural thickens, the lungs cannot expand fully, and patients often feel breathless, especially during activities. We can also see pleural adhesions. These are fibrous bands that cause the pleural layer to stick together. This limits lungs movement and can lead to ongoing shortness of breath. A related condition is trapped lung. Even after fluid is drained, the lung may not re-expand because fibrous has formed around it. As a result, the patient continues to experience breathing difficulty despite drainage. Other complications include pneumothorax and hemothorax. A pneumothorax happens when air enters the pleural space, while a hemothorax happens when blood collects there. This may occur spontaneously or after procedure like thoracentesis. Another less common complication is psilothorax, where lymphatic fluids leaks into the pleural space due to injury or blockage of the thoracic duct. We also have malignant pleural effusion, which occur when cancer affects the pleural and causes fluid to accumulate repeatedly. This often suggests advanced disease and may require long-term drainage or palliative care. So, finally, all these complications can lead to breathing difficulties, including partial lungs collapse or atelectasis. This reduces lung capacity and makes everyday activities more tiring. In summary, pleural disorders can lead to a range of complications, most of which reduce lung expansion and make breathing harder. Early diagnosis and proper treatment play a major role in preventing this outcome. So, thank you for listening.
Do you guys know what are the medical management for pleural disorder? Let's talk about it. Hi, my name is Nurul Nabila binti Ruzi and my number metric is 230030 and 75. Now, I will talk about what are the medical management for pleural disorder. Pleural disorder is treated depends on what type of pleural disorder and how severe it is for the patient. Others will require a procedure to remove air, fluid or other material from pleural space. The first treatment is pleurisis. Treatment for pleurisis depends on what causes it. Doctor will treat the underlying cause while manage the patient in the meantime. Doctor will prescribe antibiotics such as amoxicillin, azithromycin, and antifungal such as like voriconazole to treat infection. For symptom relief, doctor will prescribe NSAID or corticosteroid for the patient. While in the meantime, the doctor will do fluid draining to remove the fluid from the lung. Second is pleural effusion. For medicine, doctor will use antibiotic, diuretic such as furosemide or spironolactone and other heart failure medication. While for procedure, doctor will suggest to do therapeutic thoracentesis or a chest tube to drain pleural effusion. But for some cases, doctor will perform surgery. The first type is video-assisted thoracoscopy surgery or known as VATS. During the operation, the surgeon will make a small incision to insert a thoracoscope and specialized instrument. This allows them to see inside the chest cavity and other organ without a large incision. And the other one is thoracotomy. Thoracotomy is a traditional type to open a chest on the patient. The third is pneumothorax. It depends on the cause, size, and severity of pneumothorax. Treatment may include observation for any sign of heart or breathing problem. Oxygen therapy, thoracentesis is a procedure to placing a needle between ribs on the side of pneumothorax to evacuate the air on the chest tube drainage, and chemical paralysis to prevent the lung from collapse. The fourth is hemothorax. First, they will support the breathing by giving the oxygen therapy, but in severe case, mechanical ventilation. Next, depending on severity of hemothorax, doctor will either insert a thin needle or chest tube between the ribs to remove the blood from pleural space. If the blood continues to fill pleural space, even with drainage, a surgeon will make an incision in chest to treat the cause. So that's all from me.
Assalamualaikum. My name is Fazana Nurhuda binti Rafi'i. My metric number is 24003182, and today I will be presenting the nursing care for patient with pleural disorder. First, we must assess the patient respiratory status frequently, including the respiratory rate, depth, breath sound, and use of accessory muscles. The rationale is to identify early sign of respiratory distress and monitor any changes in the patient condition. Next, we monitor oxygen saturation using pulse oximetry and review arterial blood gases values. This is important because it helps detect hypoxemia and ensure adequate oxygenation is being maintained. Third, we should also position the patient in a high Fowler or semi-Fowler position. The rationale is that an upright position promotes lung expansion and make breathing easier. Administer oxygen therapy as prescribed by the doctor. This helps prevent tissue hypoxia and maintain adequate oxygen levels. 5. Encourage the patient to perform deep breathing exercise, coughing, and use of incentive spirometer. The rationale is to prevent atelectasis and improve ventilation by mobilizing secretion. After that, provide adequate pain relief, such as analgesic. This is because reducing chest pain helps the patient breathe deeply and cough effectively. Number 8. For patients with chest tube, monitor the chest drainage system carefully, including water seal level, bubbling, tubing kinks, and drainage amount and color. The rationale is to ensure the system is working properly and to prevent complications like tension pneumothorax. We must also keep the chest drainage system below the level of the chest. This is because it is to prevent the backflow of fluid into the pleural cavity and ensure proper drainage. Next, monitor vital signs regularly, including blood pressure, pulse, respiratory rate, and temperature, which is to detect signs of infection, shock, or sudden deterioration. Monitor patient fluid intake and output. This is important because fluid overload can worsen pleural effusion. Next, provide emotional support and reassurance to the patient. This helps reduce anxiety, which can increase oxygen demand and worsen shortness of breath. And educate the patient about breathing technique and smoking cessation. The rationale is to promote patient involvement and help prevent recurrence. Last but not least, be prepared to assist with procedures such as thoracentesis or chest tube insertion. This ensures timely removal of fluid or air to improve lung expansion. That's all from me.